Does your shoulder hurt? It might be your rotator cuff. I'm Dr. Paul Zalzo.
I'm Dr. Brad Weening, and today we have a guest.
I'm Dr. John Haverstock. Thank you for having me.
Hey, thanks for coming.
Yeah, thanks for joining us and talking to us about rotator cuff injuries. Now, we've talked about this before in a video. It was quite old, so we're redoing it. Last time you had a big beard. Looks like it.
Freshly
Last
shaved.
time it looked like you used Rogaine as shaving cream by accident that day. But today you're all clean. So what's the deal with the rotator cuff of the shoulder?
Rotator cuff is our tendons, the tendons of the shoulder. So there's 4 of them, and because our shoulder is so mobile, because we do so much with it, it often has some tears, some damage as we age.
Okay, so the rotator cuff is made up of 4 muscles that all start on our shoulder blade.
Well, there's
Yes.
tendons of the muscles.
Right, yeah, the muscles come from the shoulder blade itself.
Sits is the mnemonic.
Okay,
right?
what does that stand for, John?
Supraspinatus, the most commonly torn. Infraspinatus, a little bit behind it. Teres minor is kind of at the back, and subscapularis is kind of the more recent attention because it's a big important tendon in the front, subscapularis.
All right, so there they are. Those are the culprits. Supraspinatus, the most commonly torn one. So like we always start with these kind of things, it's what symptoms would a patient have if they had a rotator cuff injury?
Patients are going to have pain, they're going to have trouble reaching. Often it's more painful at night and with activity.
Okay, and is it always an injury or is it sometimes just a degenerative tear that happens, and what's more common of those?
So as we age, get above our 50s and into our 60s, 70s, and into our 80s, hopefully, the degenerative tear is by far the most common. So that means it's wear and tear, it's accumulation of your life, your genetics, your activity, injuries, and these add up and create tears. Kind of like, if you wear the same pants for a long time, you're going to get a hole in the knee eventually.
Change your pants.
All right, so then that's the degenerative type. What about
Yes.
the traumatic type?
So sometimes you'll have someone who falls and lands a vigorous force on their shoulder, maybe on an outstretched arm, like tripping down the stairs and holding onto the railing is a somewhat common example. And so that force can tear the tendon that was relatively normal before. Maybe there was some partial damage and you finished it off, and that's more important because we think that is not the normal state of that person's shoulder, so we think about fixing that more readily.
And that would be a more abrupt change, so severe pain relatively quickly, loss of function, maybe you can't even lift your arm, so that needs more urgent attention.
That's right, yeah. Often in a younger person who's physically active and they might not be able to do their job, and the results are best if those are fixed within 3 months.
Okay.
Okay, so those are the symptoms. You may or may not have had some trauma.
Yeah.
You've got shoulder pain, kind of symptoms you were describing. Let's say you're going to go see your doctor about it. What's your doctor going to do? Is there sort of things on a physical exam to test if the rotator cuff is the problem?
Absolutely. So the first thing that you want to find out is what's the range of motion of that joint. So you want to see how far can they elevate and reach overhead. And then with their elbow at their side, how far can you externally rotate? Everyone's different in that regard. And then reaching up your back is kind of the last basic check. So these are simple checks in addition to maybe a little bit of strength testing. So forcing the patient to resist against a force. These are the most important physical exam.
Okay.
And those muscles, a lot of people don't know, are designed to stabilize your shoulder. So it's a ball in a socket, but the socket's quite small and quite shallow. So it actually compresses the ball against the socket to allow us to do these motions.
Exactly.
Yeah. It's not much of a ball and socket. We always say it's
Ball
like
and plate
a
kind of
golf
thing.
ball on a tee as opposed to a real ball and socket like the hip.
Mm-hmm.
Okay, so those are your symptoms. Those are the signs. That's what the doctor finds on physical examination. What are the typical investigations used when you're trying to work up someone to see if they've had a rotator cuff injury or degenerative tears in the rotator cuff?
Yeah, so I would say that ultrasound is probably the most common test because it's easily available, it's relatively easy to get, and often when done and read by someone experienced, it gives you a whole lot of information about these tendons. You should be able to know, do you have a tear? What is the size? Is it part of the thickness of the tendon, or is it the full thickness of the tendon, or is it the entire tendon that's attached off the bone? So ultrasound is probably the most pertinent, common test because it's readily available. Often we'll get an x-ray because as surgeons we kind of like a nice one overview of the joint, and sometimes that's going to show additional problems.
Okay.
One thing I commonly see when we do see shoulder people is a lot of times people have bicep tendon problems as well. Why is that? Why are they so commonly associated?
Yeah, so the biceps, there's two parts of it. Goes right through the middle of the shoulder joint, and it's like a rope in a pulley, and the rope always wants to kind of jump over the edge of this pulley, and so there's often friction and fraying on one side as it goes right through the middle of the rotator cuff. So very common associated problem.
Okay, so you have the ultrasound.
X-ray
Yeah.
as well, and you've got the diagnosis.
Great.
What's the role for MRI? Because guaranteed someone's going to say, listen, my doctor wouldn't order an MRI. I think I really need one.
Yeah, MRI probably, I like to save it for surgical planning because it shows me the nitty-gritty detail in maybe a more definitive way. But often the size of the tear isn't going to dictate necessarily the treatment.
Okay.
It's about the whole package, you know, what happened, what are your expectations, what have you tried so far? These are the most important.
How old are you?
Yeah, but sorry, back to MRI. It's a great test. It's more expensive because you have to lay in an uncomfortable, noisy, closed space for about 30 to 40 minutes perhaps. And some people find it uncomfortable, it's expensive, it can take a while to get. So it depends on the circumstances. It's absolutely fine, but it's not necessary as a first line.
Good to know.
So X-ray, ultrasound, plus or minus MRI.
Yeah.
You've got the diagnosis now. You've got a rotator cuff derangement. What's the treatment plan?
So certainly physiotherapy is probably the most important treatment. So taking some anti-inflammatories like ibuprofen, taking some acetaminophen, the combination works better together. You can switch ice, you can do heat, stretching, physiotherapy, because you know the physiotherapy specifically is going to re-educate the other muscles to share the load. You've got 4 tendons if you can use all 4.
Hold the phone. You just told me I got a tear of my rotator cuff tendon. Now you want me to use that tear. Isn't that going to hurt?
Yes.
Yes, it is going to hurt.
I tell people that it can hurt
Sure.
for maybe a month, you know, that when you start a new exercise routine of any type, you might feel some pain.
That's the physical therapy you're saying is going to
Physical
hurt.
therapy. Yeah. It shouldn't hurt always. You should be able to resume it hopefully the next day.
Yep.
It should be a thoughtful thing. It should be under the guidance of a physiotherapist or a physiotherapist. But yeah, it can hurt for the first month.
And the goals are to increase the strength and improve the range of motion.
Exactly.
And reduce your pain, I guess, as well. Okay, so you've done physio, you've taken your medication.
Yeah.
You're like, you know, I'm maybe a bit better, but it was short-lived. I'm still not where I want to be.
Yeah.
Anything else for me?
Yeah, so after 3 months of physio, these other things, we can consider surgery. It's important to know that surgery is a really mixed bag. You know, sometimes a small tear will heal really nicely.
So I did the physiotherapy. My pain's a little bit better, but I'm wondering, is there anything else? Anything else we can do?
Injections.
Okay.
Yeah.
What are we going to put in there?
So most commonly, a steroid like cortisone. Cortisone, there's a few different formulas. If you can put that in the space where the tendon's normally living, it may or may not communicate with the joint, but it's like putting an anti-inflammatory at the site of the problem.
Whoa. People talk about cortisone, they say it hurts a lot, and they say you can't do it, it's dangerous.
Right.
Is there any truth to that?
I think that repetitive injections into a joint, like over years, yes, that can thin the cartilage potentially. But we're talking about 1, 2, maybe 3. I don't like to do too many before we kind of make a better plan.
Okay, so subacromial cortisone injections does play a major role in the management of rotator cuff injuries and tears and degenerative tears.
Yes.
After you've tried the less invasive stuff like the physical therapy, the anti-inflammatory pills, the acetaminophen.
There's one newer kind of injection that we've heard a lot about on the internet. What about PRP? Does this play a platelet-rich plasma? We have some videos on this. Go check them out. What does the evidence say about using it for rotator cuff tendon tears?
So the evidence has been quite mixed, and I don't think it's a positive recommendation at this point because there's so many different types of tears and so many formulas of PRP. So it hasn't proven clear benefit.
Hard to study well that way.
Definitely.
So PRP doesn't always get the RESPECT, does it?
Oh my.
That it deserves.
Yes. That's a great A to Z of the non-operative side of rotator cuff tendons. We're going to do a follow-up video on the surgical form. But now you know you can talk intelligently with your family doctor or your practitioner about your shoulder pain. Paul, you got something else?
Yeah, this is super common, by the way.
Oh my
right?
goodness.
Would you say this is one of the more common
It's-
shoulder problems that you see?
The most common, for
It's
sure.
super duper common. I mean, I'm not even a shoulder specialist. Shoulder isn't the mainstay of my practice, but I still see a bunch of shoulder problems, and it's usually the rotator cuff that's culprit or arthritis. And that's one thing that I think we try and distinguish between. Is it your rotator cuff or is it degenerative arthritis, which we'll talk about on another video.
Now you know. If you like this video, please like it, subscribe to our channel.
Remember, you are in charge of your own health.
See you next time.
Thanks, Dr. Haverstock.